Advances in early cancer detection and combination therapy have helped people live much longer lives. In fact, more than 80% of adult patients diagnosed with cancer survive long-term. Consequently, a longer lifespan means patients are more likely to develop chronic diseases, especially heart disease. Research published in the American Journal of Managed Care in 2019 showed that survivors of certain cancers can have 2 to 6 times the risk of death from cardiovascular disease. Patients with breast, prostate, and bladder cancers had the highest risk, accounting for 61% of all cancer survivor cardiovascular deaths. More recent research published in the Journal of the American College of Cardiology showed a 42% higher risk of cardiovascular disease for cancer survivors than those with no cancer history. Specifically, cancer survivors were found to have a 52% higher risk of developing heart failure and 22% increase in stroke. While cancer and cardiovascular disease share many of the same risk factors, such as poor diet and tobacco use, the study's author indicated that the increase in cardiovascular disease could be due to the aggressive treatments that accompany the cancer diagnosis. The National Cancer Institute has stated that cancer treatments can affect many organs of the body, especially the heart, and cardiovascular conditions can be exacerbated by radiation and chemotherapy. Cardiovascular laboratory tests for cardiovascular disease risk factors are imperative for treatment of cancer survivors. The American Society of Clinical Oncology recommends routine surveillance for cardiac dysfunction for survivors of certain types of adult cancers. Prevencio's heart AI-driven blood tests are a breakthrough in cardiac care and prevention, employing AI to produce test panels of multiple proteins and clinical variables, combined with an algorithm to create a cardiovascular risk score. To learn more or order your test kits, visit prevenciomed.com or call 425-576-1200.